Good afternoon. By way of throat clearing, apologies I haven't been much around on the forum lately, or if that's been a good thing for you, then apologies that I will be back around a bit more now. There have been a few bits popped up that I thought would benefit from a little CPD snippety thing, so without further ado. In particular, there's been a lot about ingrowing toenails, nail bracing systems of various types, the gel bracing systems, the Archides cube has come up a few times. So I thought I'd just do a few little snippets on ingrowing toenails, just revision for most of you, I'm sure. And we'll start off with an element of an ingrowing toenail that not everybody assesses and which does inform what kind of treatment is best. And that is the different types of involution. And Jane posted a picture of one and gave me permission to use it, which I shall stick over there. Now, there's a few things you'll notice about this. One is that it is not uniform all the way down its length. It is relatively straight at the proximal end and becomes more tapered as it grows down. That's a fairly common pattern, probably caused by external pressure, and it does make a difference to how you treat it. So there's a couple of different types, well, there's more than a couple, but here are two different types of involuted toenail. No expense spent, obviously, on this marvellous post-it note based model. So this one, the curvature is uniform. If you come underneath it, you get a better feel for that. The nail is the same shape throughout. Now, because it is involuted, you will get a lot more load at that edge and along that edge, because pressure downwards on the top of the nail will exert the pressure there and there disproportionately. So this can cause a painful involution and could indeed cause an ingrowing nail. However, unless they're in shoes which are too small and there's compression in that direction, what you'll generally find is that pressure is exerted along that whole length of the bit of nail. And these are the ones that we tell people not to cut down the side, because if a patient comes along, or indeed an over-enthusiastic podiatrist comes along and cuts the nail to get rid of the corner that way, especially if the angle is too oblique, then you've got the same amount of downward pressure exerted on a smaller area of nail. And of course, force over surface area hurts more to be trodden on by a stiletto heel than an elephant. The smaller the area, the more likely it is to dig in. And what very often happens is a patient will cut it off like that, then you'll get pain around that area, so they'll then cut that bit off, and then you'll get pain there, so they'll cut that bit off, and they end up chasing it down. And when that's happened, all you can really do is do the P&A and make it narrower. So that's one type of nail, and these ones, if you can, you want them to grow to the full length, and usually they can be kept quite safe. These, however, are a bit different, and this is like the one that, that Jane posted. The curvature is different all the way through. On this one, at the proximal end, the curvature is very little. At the distal end, the curvature is more, and you can see the difference looking at it an end on view. Now, because it is curved that way, you will notice that if we view it from the side, unlike a uniform one where it's straight, that one exerts a lot more pressure right at the distal end there. So in terms of treating these, some of the tricks that you can do on these don't work on the others and vice versa. With these nails, to actually get a uniform pressure along there, you don't want to let it grow too long. You don't want to do what you need to do with that one, which is to let it grow out. With these ones, you actually have to reshape the nail somewhat in order to get a uniform pressure. So if I'm trying to cut this nail in order to spread the load out so you don't have that nasty corner digging in, I can actually do that by changing the shape of the nail. So if I cut at a nice shallow angle, you don't want to be coming across too sharply with the angle. And do the same on the other side as well. So by cutting off that little sliver there, we've created a much more even amount of load down there. So when that pushes on the side now, instead of one corner pushing in, it's pushing in across a broader zone. So with that now, that would be a sensible approach. With this one, the uniform now, if we do that, then we have created the problem. So with that now, if we do the same thing, if we cut that edge off, what will tend to happen is that you'll start getting pain there further down, and then you end up just chasing it back down the nail. So something to be mindful of when you are cutting or resectioning involuted toenails. Pay attention to how they are involuted. They're also rather different in terms of if you were going to try and brace them, if you were using nail bracing. With this one, in order to actually get that to grow straight, you would have to straighten the entire nail plate. You've got a lot of area there that has to be reshaped, so you've got to exert a lot of force on it. And if you're using a passive system, which usually means you can only lift it up in one area, that's really, really difficult to do. You can't use a passive system right down there proximally because you can't lift those bits out proximally. Whereas with this one, you don't need to. All you've got to do there is just straighten out that last sort of third quarter of the nail. If you can persuade that to be a little bit straighter, then you create a much better scenario. So that one would benefit more from a P&A. That one, certainly you can treat it with a P&A, but you've got a more reasonable chance of getting improvement with nail bracing. So I hope that's helpful. I will try and do a few more bits and bobs on nail bracing particularly, because there's a lot of people asking about the different systems, and it's a little bit of a concern because the systems all have something to be said for them, but there are things that they work for and things that they don't. And since nail bracing seems to be having a renaissance, it's probably worth going into a bit more detail. So as always, any queries, questions, anything else you want me to talk about, just stick a comment. Otherwise, hope that's helpful.